I think that is important. Overall, we're not really sure exactly, though the DLQI asks specific questions, how a patient feels when their skin is clear, although the clinician would expect them to have a low DLQI because their skin is clear and they have relief of this pain and itching. It's not always, really correlated. And so I think that this study shows that this high impact of an effective biologic with low amount of itching, pain, and less scaling and durability shows that that does affect the quality of life and does allow these patients to have clear skin and a low DLQI. I think it's extremely important because having clear skin does not always correlate with an improved patient reported outcome. There are many things with the DLQI that does not cover, such as joint pain or adverse events. So that's one thing. And the relief of itching and skin pain and the patient noticing less scaling doesn't always correlate with a better quality of life. And this study reinforces that with bimekizumab over 3 years, not only do you have symptomatic improvement of the signs of psoriasis like scaling, but you have this improvement of the quality of life. So something is a little bit extra where we have this persistently low clear skin, but the patients feel good about it. And that is what I feel is important so that the patient can continue to be comfortable and live a life free of psoriasis without the discomfort that's associated with it. I would say that longer term, so past 3 years, to look at 5 years, if it's available. Comparing it to the real world evidence is extremely important as well. So yeah, clinical trials are clinical trials. That's a very specific and special group of subjects and individuals that doesn't always correlate to the clinical experience that we see in practice. And so comparing to real world evidence at 3 years with commercially available bimekizumab would be important to reinforce the study, this B-Radiant study with PROs at 3 years. And if that non-head-to-head, but that statistical comparison would take place, it would reinforce to physicians that bimekizumab can provide this persistence of clear skin with an improvement of the quality of life. And so that RWE is important to look at. I think that, that looking at some different endpoints, so possibly composite endpoints, not only PASI 0 and DLQI 0, but patient symptoms with DLQI. I think that an open label extension, when they're on open label, could have a bit of bias in there. The patient knows that they're on the medication as well, and this also switching from secukinumab to bimekizumab is protocol driven. So that's not reflective of a failure driven switching or an adverse event driven switching that we see in real practice. So at 1 year, they're by protocol are going to go from secukinumab to bimekizumab, but those secukinumab patients could have been fine, had a great DLQI, their skin could be good, but when you look at the group of them and those that switching had continued improvement, but in real life they may have stayed on secukinumab and then been perfectly fine and their skin improved. So a study will always have that, but I think that it doesn't take away the importance of the study and that the PROs are extremely important to look at when looking at treatments for psoriasis. So the low dropout rate was consistent along multiple endpoints, which is important. And that's why that showed this persistence over 3 years. So having a study where you have a lot of dropouts, whether it be from adverse events or loss of efficacy, sort of ruins the data a little bit. So in summary for this paper, I just want to reemphasize that many of the patients on bimekizumab had no itch or pain and did not see scaling as early as week 4, showing the rapidity of improvement and maintained that over 3 years. That complete skin clearance has a impact on the quality of life, having low DLQIs for these patients. Also, those that switched from secukinumab to bimekizumab, according to the protocol, showed further improvements. And that group, after a year, that was secukinumab, that was switched to bimekizumab, was able to catch up to the initial group that started on bimekizumab. And then finally, that these results show that bimekizumab high efficacy does translate into a meaningful and durable improvement in the way patients live with psoriasis.